So I want to talk a little bit about the also dominating topic this year, the COVID-19 crisis. So when we started this year with NF Patients United, we had huge plans of what we wanted to do. And then, as we all know, COVID hit the whole world and changed everything. So we were not able to do all the things we planned to do. We also had to adapt to the new way of living, the new way of communicating. And of course, as you can imagine, also non-profit organizations who rely on donations had a very difficult time in this crisis that also affected our economies so hard. So the European Umbrella Organization for Rare Diseases, that's EURORDIS, conducted a survey, and that really showed how severe rare disease patients in Europe were affected by the COVID-19 crisis. As you can see, COVID-19 caused a severe disruption of care. 6 out of 10 patients reported that they did not have access to diagnostics such as blood tests and medical imaging. Of course, that also affected NF patients. 8 out of 10 patients reported that they had interventions such as physiotherapy postponed or even canceled. 6 out of 10 patients also were unable to receive therapies, medical therapies, such as infusions, and in some cases, even chemotherapies. Also, 6 out of 10 patients reported that surgeries and transplants were canceled or postponed. 7 out of 10 patients reported that their medical appointments had been canceled or postponed. And also in terms of psychiatry follow-up, 6 out of 10 patients had their sessions interrupted. So the impact of COVID-19 on rare disease patients has been huge. Also in terms of hospital care, this survey was addressing some questions. So hospital care for rare disease patients was particularly stressful and difficult to access. 47% of the patients said they didn't go to the hospital because they were scared of catching COVID-19. So almost half of them, 34%, said they were told not to go to the hospital if their health problem was not COVID-19. And that's really something where you have to blame the communication of our health systems and of our politicians. 25% reported that the hospital or the unit that normally provides their care was closed. So in all crisis and in all bad situations, there's always something good coming out of it. And I think the good part was that e-medicine, telemedicine was taking up. So 50% of the respondents participated in online consultations. And they found that this type of consultation was very useful, in particular to get prescriptions via emails. 98% said that was a very good thing. 90% had online education tools designed to help manage their rare disease and said this was really helpful. Another 90% found online consultation or other form of telemedicine useful. Sorry, that was already mentioned before. So when the crisis hit and when Europe step by step went into the first lockdown, NF Patients United members came together, and we all were contacted by patients and caregivers that had a lot of questions. So we set up a page at the NFPU website where we collected information about COVID-19, statements by doctors, also useful links to official sources, because what we also learned from this pandemic is that misinformation is a huge problem. We saw a rise of conspiracy theories, and that all undermines the trust into medicine and development and vaccinations, which are now finally, but very quickly, luckily, will be approved shortly and will be made available across Europe. But the skepticism is really high. So we started with providing information on our website. Additionally, we organized informational webinars. So we had one webinar with Dr. Eric Legius, who is one of the leading experts in the world for NF. And he was talking about the topic, NF, am I a high-risk patient for COVID-19 because I have NF? What do we know at this point? And thanks to our members, we were able to provide translations via subtitles in Spanish, German, Dutch, French, and Catalan. The second webinar that we organized was dealing with the topic of the psychological impact of COVID-19 on the NF patient community particularly. And we had the joy that Dr. André Rietman from the Netherlands was giving a presentation on this topic, and also both were answering all questions that we had, and they took well over 1 hour of their precious time to sit down with us virtually and be available for any questions. Again, with the help of our members, we could translate it into German and Dutch as well. These webinars, again, can be found at the YouTube channel of NF Patients United. Because we were also not able to do events like we normally would do in order to raise awareness and raise money, we had to use the internet to do this, the virtual space. So one campaign that we did was that we invited everyone to visit our countries. So we, in the first lockdown, we collected some nice online content that makes it possible for you to, for example, in that case, get to know the United Kingdom better, or to visit Russia. Or we had content provided by the Catalonian Association from Austria, from Greece, from Portugal, and from the Netherlands. And from Italy, we posted all this information on our Facebook site. And I think in the first lockdown, everybody was very grateful to get some inspiration of what you could do in your own house or your own apartment that you were not allowed to leave. We also wanted to highlight the incredible work that the health professionals were doing and are still doing, unfortunately, or have to still do to fight COVID-19 and to help those patients who suffer a severe course of a COVID-19 infection. So as you might know, there was the campaign using a rainbow as a symbol of hope. And we invited children with an F all over Europe to send us a picture or drawing or a photo that we then also shared on the NFPU Facebook site, to just raise some awareness for the incredible work of the health professionals. Because we couldn't do the Shine a Light campaign that we wanted to do, where we work with the Children's Tumor Foundation, who started this campaign, and the idea is to light up public buildings and sites all over our countries in the colors blue and green, to raise awareness for NF. We also had to change this approach. So we did Shine a Light on NF from home, where we posted different ideas of what you could do to raise awareness on social media. For example, you can see examples of people who cooked dishes in the colors blue and green. So you can see some cookies there and some pancakes. We were inviting people to dress up in blue and green, or wear makeup in blue and green, to light their own apartment or house. So we had some really great contributions. And Our member association in the UK, the Childhood Tumor Trust, they did something really cute. They invited people to have a teddy bears picnic and raised awareness that way. So we were still able to use the virtual space to conduct some campaigns and raise awareness.